cancer treatment and are cancer free. So now what? Well, here we go. Welcome to survivorship. So let's define survivor just by what survivor is in the dictionary. We do know that in cancer treatment, survivor is from the date of diagnosis, you are a cancer survivor. However, for our purposes right here, I want to define it by what I think of each of my patients when I see them. The survivors are to beat the odds, one with great courage and strength, a true inspiration, and every patient I see leaves me feeling this way. So why are care plans so important? Well, first let's talk about what's inside of it. Inside the care plan is a complete and concise treatment summary, which is permanent and mobile. You can take it anywhere. The summary of treatment that can travel with you to any clinician, any hospital, in any country around the world. So if you've gotten care in Japan, the medications they use, their generic names will still be the same here, and I will know what treatment that you've had. So vice versa, if you take your treatment plan to Japan, they'll know what happened to you. And so why is that so important? History doesn't change. Life after cancer can be complicated, which is a definite understatement. And, help a provider out. For me, when I see somebody after they haven't been seen by someone for a long time, it's important to know what medicines they've taken, what their history is. And that care plan really helps providers know where to start or where to go from. So why come to a specialized clinic? Well, first and foremost, it's the absolute new phase in your life. You're done with cancer. Now you have to move on into a different thought process because your body is changing and you need to, and it has changed and it's gone through something really significant. So also to get some empowerment, this care plan will not only just tell you what treatments you've had, but how to move forward with how to make sure your body stays as healthy as possible. And for me, that's really key. I mean, some treatments can change the way your hormones function. If your hormones don't function the way they're supposed to, it can affect the heart, your body, your bones. It can trickle down. So we want to change. We want to be able to make sure you stay as healthy as possible. Resources. We have tons of resources at our fingertips, and that's different clinics to go to, care specialists to speak to, different ways of getting treatment, different ways of having good mental health. Advocacy. Anybody who knows me, anybody who's been my patient can tell you that I'm one of the best advocates you can have for yourself, because I will fight for you. I will make sure that people listen, and any good clinician will do the same thing for you. So you don't have to come to me. You can go to any survivorship oncology clinic, and you should be able to gain advocacy. But we'll also, by the way, teach you how to advocate for yourself, because I do believe that's one of the most important things of my clinic is I teach you where to speak up. You have new medical needs. After cancer, there are other risk factors to pop in. There are other things to screen for. There are other things that you want to stay on top of to make sure your health is as taken care of. And we have the most up-to-date guidelines. I do tons of research on the different guidelines that pop out from the Children's Oncology Group to the NCCN to different articles to make sure my care plan stays as up to date as possible. And we're clinicians who specialize in this. Now, are we going to become your oncologist? No, we don't become your oncologist. We just tell you how to take care of yourself and what potentially can happen and how to stop those from happening or treat them as early as possible. But we specialize specifically in survivorship, and it's really important. So which survivorship program to go to? There are many programs out there. Obviously, there's one here at USC, which I think is the best, but I'm not objective about it. But the best one for you is the one you'll actually make an appointment and go to. As you're going to find out, we put a lot of time and effort into your care plans. We really want to make sure that you show up, and that it's not something that you kind of say, oh, I don't think I really need to go, because you'll see what we put into it in a second. What makes us so special? Well, we are constantly in motion, and we're constantly evolving. This year with COVID on top of us, we've had to evolve even more. So what we have done is we've done telemedicine follow-ups. We do some initial clinic visits with telemedicine, but the thing is that it's such a personal experience back and forth, and it is a one-time visit for us here at USC that we really want to make sure you get the most out of it. We have a nurse that help keep in contact with all of our patients. We do tons of community talks. We have discussion on sexual health, and we have a desire to keep on growing. And that's the part that makes us really special. So some of you guys might have questions on how do you get in to see us? Well, in our clinic here, we have specific guidelines. You have to have been treated before the age of 50. with curative intent. We have to have multiple modalities of treatment that can produce late and long-term effects that we can monitor and help you with. And sorry. And those are our criteria. So if you want to come into us, you should ask your physician if your treating facility has one. And if they don't, find out who they would refer you to. Do research. Everything is online nowadays. You can find survivorship programs all around the place. If you have an HMO insurance, your doctor has to make a referral to get an authorization. If you have a PPO insurance, then you just call the clinic directly and find out how to get on the schedule. And then make the appointment. I can't tell you how many people have told me I've known about you for ages and I just didn't come in. So make the appointment. I'm relatively unassuming. I promise you, you will have a decent experience, a pretty good one as a matter of fact. So what do you do to prepare for this? Well, what's next? In order for me to give you the best care possible, I need to know some things. I need to have your past medical records, the chemotherapy that you got, the radiation you got, surgical records that you have. It would really help to have your last oncology visit note from any of the specialties that took care of you during your treatment. Any type of tests that you had, like echoes or DEXAs or pulmonary function tests or PET scans. These are important things for us to know to put together a really comprehensive care package for you. And what we'll do is we'll review all of it. But we'd like to have them 2 weeks before your appointment because that's a lot of information to take in and digest. Why is it important to do this ahead of time? Well, preparation. We have your visit is an hour visit long, and we use that entire 60 minutes. I can guarantee you that, sometimes over. We have to review your history to put together a care plan for you. And we want to make sure that the side effects we talk to you about, the late and long-term effects that we talk to you about, are things that are important. Sometimes as time goes on, your risks actually get less for certain diseases, and we want to be able to take away the risks. We want to be able to help you find out what are the most important things to focus on. We want to respect your time. It's really important, but also we are really well aware of the financial impact cancer can have on our patients. So we don't want to order duplicate scans or duplicate copays. We don't want you to have to take unnecessary days off from work. We don't want extra appointments there. We really want to optimize your visit, and so do you. So before you go, some things that you need to know. This visit is it's not mandatory, but it is in your best interest, because where will you get an hour to talk about how to monitor your care after cancer? It is a full hour, potentially longer. And at that visit, you'll see me, Dr. Fryer, my attending, and our social worker, because we truly believe we want to take care of you both physically as well as emotionally. You know, we'll review your labs, order labs as needed. We may refer you to specialties. We may order tests like echocardiograms and DEXA scans. At this visit, this is a very comprehensive visit. So how do you mentally prepare? Well, maybe ask a partner or a friend or a parent to come with you. There's a lot of information going through. Put the appointment in your calendar and make sure it's there, because we really do want to see you once you make that appointment. Most people usually get an appointment call from me like, "Hi, I'm Yasmeen. I'm the physician assistant from our survivorship program. Welcome to Survivorship. I can't wait to see you." Because most of you will get actually a call from me when you come in, before you come into our clinic. We want you to make sure you arrange your time off from work and transportation, because we want, and before and after the appointment, to make sure that you get the most out of it and you're not rushing through it. And think of questions you may have and write them down. I said that last, but I put this first on the list because it's the most important one. Think of questions. This is your visit. Think of there's no such thing as a dumb question. And we really want to make sure that we give you the time and the attention that you deserve. And we want to make sure that we help you with the thought process that you may have after cancer. So what happens at the visit? So things that we're going to do, and you're going to go, "Oh my gosh," again, is we're going to take a whole new history from you. And the reason why is, while your cancer history doesn't change, neither does your past medical history or your family history, your life changes from day to day to day. People get on medications, they get off medications, risk factors get added in. We want to know your social history. We want to know what's going on in your world. And then we'll do a full-on, pretty thorough physical exam. We'll check you from head to toes for possible late effects, like check you for cataracts, moles, and check your surgical scars. Teach you how to do a breast exam or testicular exam. We do teach self-exams. We check you for lymphodemas if you've got breast cancer, scars, and all of the above. But here's the part that's really most important to me. My favorite movie is Patch Adams when it comes down to medicine. And there's a quote in Patch Adams: if you treat the disease, you win, you lose. But if you treat the patient, you win every time. And for me, that has shown up in my career time after time after time, from personal stories that how having a physician or a clinician that cares for me has affected me or my family personally, or to how it's affected my patients when I see them, because this is a relationship we're building. We spend the time really getting to know you. We ask you the hard questions. We want to know what your hopes, what your dreams are, what your aspirations are, what your ambitions are, what's the most important things for you. I want to get to know you as a person, not just as my patient. We talk about subjects that you may not really have thought to bring up or don't know who to bring them up to. Chemo brain, work adaptations, body image, sexual function or dysfunction. We actually have resources and referrals for these things. Relationships, and what your expectations for yourself are. I have one lady who came off of cancer treatment and she's like, I can't run a mile yet. I'm like, when did you finish your treatment? About 2 months ago. I said, okay. How much did you run before that? She's like, well, I run about 5. And I said, that's understandable. I can help you go to physical therapy and we can do cardiac rehab and gain your strength up. But you had cancer. You didn't have a cold. We want to make sure you're aware that, yes, you can get all of these things back. We can work towards that, but have some expectations that, hey, listen, if you can't get there now, we will help you get there eventually. That's our goal. Your goals are my goals. We help you with that. We discuss the importance of primary care because we don't become your primary care clinicians. We actually tell you the importance of going to your primary care doctor, getting your dental checkups. If you don't go to the dentist and you come see me, you'll get a whole spiel about how your gums have so many blood vessels and it can disperse things all over your body. You will roll your eyes and shake your head, but you'll hear it, I promise. About other cancer screenings that you might have to do. Just because you had one doesn't mean that you can't get something else. We want to make sure you're well aware of what you need to do to stay on top of things. We cheer our patients on. We laugh with them. We celebrate things like birthdays and weddings and engagements and babies being born. Those are my favorite visits. We cry with happiness and in sadness with patients. We work really hard to help our patients live the best lives possible. And something that I take my patients home with me. I say that to everybody. Like when I see someone, I take them home with me because you're a part of my world now. So what happens when we give you the care plan? Well, we'll review the treatment that you had. It's really important. I review it with everybody. I tell you the names of the medications. I tell you the radiation you got. I'll give it to you in the medical terminology, then I'll explain it to you in normal people English. And the reason why I do this, it's really important for you to be aware of what your treatments are. We discuss the risk about possible late and long-term effects, like what can happen. And I tell people this, just because I say something can happen doesn't mean that it's going to happen, but now you're armed with the knowledge to stay on top of it. And that's the part that makes me feel comfortable and hopefully makes our patients feel comfortable. We give you monitoring suggestions. So certain medications get certain type of monitoring. We go over them and tell you why you need to be monitored for it. And then even help you get into the clinics that you need to go to. And then this is the best part about all of it. At this point right here, it's my favorite part. We have a discussion of what is no longer a possible late and long-term effects. I love taking risk factors off the table. It really makes me happy. For some patients, we've done a 10-year off treatment dance. We've had a dance party in the clinic room. People have looked at me like, what the heck is going on? But we celebrate these things. Also we use the latest and greatest research and guidelines on preventative medicine catered specifically to you. These are not canned care plans. One doesn't go for everybody. We really cater these care plans specifically to your treatment. We order the baseline tests like echocardiograms and hormones and DEXA scans. So to know where you stand now, right after cancer, because it's hard to know if there's a change if you don't know what you started with. And let me give you referral to resources that can help, like physical therapy, occupational therapy, nutrition, sexual health counselors, medical subspecialties. In our visit, you'll see all of us, and everybody puts something on the table for you. And before you leave, these are some important things to really make sure everybody gets a care plan at the end. You don't get the care plan at the time of the treatment because I need some time to write it up and review it and make it look nice and hand it over to you. But in about 3 weeks from our visit, in the patient portal, the care plan will get uploaded for you. And at that care plan, you have to take to your primary care physician so they know how to treat you and they know what to do with you. We make sure you have a way of reaching your survivorship clinician. Everybody gets my card. Not everybody keeps my card, but everybody gets my card. Ensure they have a way to get your finalized care plan to you. If you are one of my patients, you really need to join the patient portal. It's so important. Otherwise, make sure you follow up. And make your follow-up appointments for any tests and consults or other referrals, because you can't get any of this information if you don't make those appointments. So here are some websites that I love: cancer.net, cancer.org, cancercare.org, the Children's Oncology Group. And I love that group just because the fact that I know everybody here is an adult, but there's so much research on survivorship for children. And I think it's amazing to see what they have learned over time. And that's helped us guide where we go, what we do with our adults as well. Canceradvocacy.org and Stupid Cancer. There are more, but there's not enough space to put up here. But questions, concerns, and more info, here's the deal. You can call me. I am readily available I call my patients back regularly. Email me. Just get in touch with me. I'm happy to answer questions for you. I'm happy to help you get into the clinic if you want to. I'm happy to send you to a clinic closer to you if there's some place that you don't want to come out this direction. But call me. And then I'm a firm believer in giving gratitude to the people who have helped you along the way. So first and foremost, thank you so much to the patients who have given us feedback on their for us to continuously improve. Dr. David Fryer, I wouldn't have this job if he hadn't started the program and had the vision. So that's really, really important. Ava Jones, Darcy Spicer, and James Hu, and then the rest of our AYA team, and everybody has played such an important role in helping our clinic grow and thrive. And here's something I thought this is really important to know. Sometimes the strength within you is not a big fiery flame for all to see. It is just a tiny spark that whispers ever so softly, "You've got this, keep going." And for our patients, we want them to know that we've got you. You can keep on going. And that's it.